Hey Facebook friends, it's Shayna from the Center PC at the Center Yourself Medical Spa, and I'm here with Julie. And today we're going to teach you about our non-surgical brow lift. So I'm going to go ahead and turn it over. Hey Julie.
Hey.
I'm actually going to go live on Instagram now. I'm getting connection. All right, now we're live on Instagram. Okay, so Julie, this is one of your specialties. We're going to do Botox, but the non-surgical brow lift. So explain us how you're going to be doing that.
Okay, so today, this is Jim. He has full eyelid look, kind of a heavy eyelid look. He doesn't feel like he's quite ready to have like an upper blepharoplasty, which is removal of this skin here. So we can do what's called a non-surgical brow lift. So with a few little injections right in this area, I can actually raise his brow. So his eyelids won't feel quite as heavy, and it'll just give him a nice open look.
Now, so what kind of product are you using for this?
I'm going to use Botox. Yeah, we love Botox here. So with the brow lift, I'm also going to soften some of his lines out here on his crow's feet.
Perfect. Okay, so we're going to go ahead and start injecting. Now, Botox can also be used, you don't have to have a brow lift, non-surgical brow lift for this procedure.
Correct. Okay, make mad face. Okay, relax it.
Yeah, some strong corrugators.
It's really strong.
So sometimes for men, we tend to inject a little different, wouldn't you say, Julie?
Sometimes they're just so strong in these corrugators right here that I'm injecting that sometimes it just requires a bit more Botox.
Actually, I'm really impressed because usually when
raise your eyebrow, please. Okay, relax it.
Botox, you usually bleed a little bit, so he doesn't really have too much bleeding.
Yeah, it's nice.
So right here is where you're going to be creating the non-surgical brow lift.
Raise. Okay, relax it. Okay, moving on to crow's feet. Turn that way a little bit. Okay.
Now, one thing I noticed that Julie did that, and then you can watch in our other Botox videos, is usually you go up more on the forehead, like creating like a W.
Mm-hmm.
But since he wants more of a brow lift, that is not what you did.
Correct, yeah. For him, I really could never inject up here. It would relax that frontalis muscle too much and bring everything down further. So, but for a lot of patients that come in, they want these horizontal lines here softened, and that's where I would inject up there and take care of those lines.
But since he already has a heavy lid,
yeah, we have to just stay off the forehead forever.
Oh, sorry, Jim.
That's okay.
It's okay.
Okay, so what was the pre and post care for this procedure?
So pre-care, there's really not a lot you need to worry about. We just ask that our patients maybe stay off of ibuprofen, Excedrin, aspirin, maybe give up that glass of wine for a few days before you come in, fish oil. Those things can create more bleeding, and bleeding can potentially lead to bruising with Botox. And then post-care, really we just don't want our patients to lie flat for 4 hours after the procedure. No strenuous exercise for 24 hours. And really important, we wouldn't want anyone to like massage or push on those areas, because it can, especially with something like this, the brow lift, it could move the Botox around and it could go south and give him a droopy eyelid. And we want lift from all of this.
Perfect.
Quick
Nice.
tippy.
Now, really quickly, let's go over to the chart over here and see, can we look at how many units you injected?
Sure.
Okay, perfect.
Yeah, so I injected 45 units today, 25 units right in the glabella area, 2 units on each for the brow lift, and then 10 units per side for the crow's feet.
Perfect. So that's 49 units, and we charge Botox at $13 a unit.
Yes.
And these kind of, you can see here with Jim, he has these little bitty like bumps. Those go away within like a half hour, wouldn't you say, Julie?
Yeah.
So really, the great thing about Botox is you don't even know that you've had it done.
Right. Right. Quick and easy.
Yes. Great for men. We call it Brotox.
Yeah.
Thanks, Jim,
Yeah.
for
You're welcome.
volunteering.
No problem.
All right, so if you have any questions, you can come see Julie. She's a registered nurse at the Center Yourself Medical Spa. And that's it for today for us. And we thank Jim for coming in. One last look. Awesome.
Looks good.
Yeah, I can't wait to see in like 10 days how
Yeah.
it's going to lift.
It's gonna be
So
great.
we'll post his after photos in about 10 days. All right, bye guys. We'll be back next Friday.
Okay, hold it.
Oh, okay.